Warm welcome, everyone, to the Cedar Talk, and of course, everybody on the Zoom. And first of all, warm welcome to you, Jay. It's great to have you here with us.
Thanks so much. Great to be here.
And yeah, we want to greet, of course, everyone. So we have participant. I definitely know we have one from England. We have a lot of people on the East Coast here in the United States, also some on the West Coast. So thanks everyone for joining. Really appreciate it. I'm going to start to introduce our speaker here, Jay Desai from PatientPing. Then we're going to have a quick Q&A where I'm asking him some questions. He might ask also myself some questions. We're discussing some topics about innovation, about healthcare, and about where the healthcare system will be going, especially in these unprecedented times. And then afterwards, we want to give you also the opportunity to ask us some questions. Feel free to afterwards use the chat, just put them in there, and we are going to answer them as we deem appropriate, as we have time. Everything will take probably around 50 minutes so that we are done right before 2 p.m. Eastern time. As I mentioned, Jay is the CEO and co-founder of PatientPing, which is a healthcare technology company that connects thousands of providers across the nations through real-time notification and patient insight to seamlessly coordinate the patient care. As a devoted healthcare reformer, Jay has spent his career creating tools that transform the healthcare system into one that provides higher quality at lower cost. His passion lies at the intersection of technology, policy, and community building. Jay has spent the last decades as a health policymaker, executive, and investor. Prior to co-founding PatientPing, Jay worked at the CMMI, where he helped design and implement ACO, bundle payments, and other innovative payment models that would become the cornerstone of value-based care. While in this position, he was struck by the gaps in communication that made care coordination difficult. PatientPing, born out of this desire to find a simple solution that would transform the way providers would collaborate together on their shared patient. Jay has served as a subject matter expert on health reform for a variety of provider organizations and co-founded the Healthcare Transformation Task Force. Jay earned an MBA in healthcare management from Wharton, a BBA from University of Michigan, and is a Cora Fellow. So warm welcome, Jay, and it's great to have you.
Thanks, Marian.
So we might want to start, given your background. I think your background is really fantastic and super exciting for a lot of people on the call, because you started on the policy side, on the investment side, and then started your company out of that drive. Can you just maybe walk the audience through your decision process of you really saw this problem, you saw it was not being solved without starting the company and making then this crazy plunge into entrepreneurship to start a company?
Yeah, so prior to starting this company, I was working at Medicare, and one of the jobs at Medicare as part of the Affordable Care Act was to make it such that providers were rewarded to deliver high quality care at a lower cost. You know, my job was a pretty low level account manager type job, I would say, is the most kind of clear corollary to, you know, to the work at a tech company. And we had a number of ACOs that we were working with that just started. So they were brand new accountable care organizations who were doing the work of managing a panel of patients, coordinating their care, keeping them out of the hospital, which was really the goal, you know, by delivering preventive care, managing their follow-up after they're hospitalized or when they're in the emergency room, really to wrap around a set of services so that they don't end up in the hospital. And, you know, as essentially an account manager, my job was to understand their needs, think hard about what they needed to be successful at delivering, you know, high value, lower cost care. And one of the things that kept coming up over again, you know, and I used to ask this of our customers, which I think a lot of our team members probably ask of our customers, you know, what's your wish list? What can we do to make you more successful at what you're trying to accomplish? And as part of that, one thing kept coming up again over and over again, and not in these specific words, but as I talked to enough folks, the theme became clear, which is like, I just need to know where my patients are. I've got a lot of patients, and let's say I'm a physician group, or I'm a provider organization that's part of New York Presbyterian Hospital, let's just say, and my patient goes to Montefiore, or they go to Mount Sinai Hospital. I have no idea that it's happening until you send me the claim Medicare, and this is when I was in my role at Medicare, and it's too late. They've already had a hospitalization. They've been in and out of the emergency room maybe once. They've gone to a nursing home for several days, started home care, and then that's when I find out about it, when I could have had an opportunity to maybe manage that episode, equip those providers who are treating the patient with information that would have helped them to make sure that the patient got the best possible care. So that was something that kept coming up over and over again. And after sort of obsessing about the problem, getting really interested in this problem, and seeing that there weren't really any very viable solutions for it, that at the time, this was 8 years ago, I sort of decided to leave and start something from scratch.
I think that's very inspirational. And Jay, you might know this. I'm a physician by training, so I know, of course, this problem. And just to clear up any doubt, this is not necessarily a problem for the doctor because the doctor is losing revenue or losing anything on the patient. It's much more on having a high quality for the patient in the journey and getting the feedback on the treatment. And sometimes it is the treatment, sometimes, of course, cost is the problem. And sometimes it's also that the doctor wants to improve, for example, how the doctor communicate to the patient so that the patient has adherence. Mm-hmm. So I think this feedback is actually amazing for the doctor.
Right.
Can you talk a bit about the impact that PatientPing has created with the provider organizations? Feel free to share just a few separate stories or also on a macro level.
Yeah, so, what happens, when patients get care from a lot of providers. So let's say, and not everybody does. So if you go to the hospital, you break a thumb, you end up back home after you've got a cast, you're otherwise healthy, you probably don't need a lot of coordination of care. You go to the hospital, you come home, and then otherwise you're fine. Care coordination, where you want all of your doctors, your providers, nurses, care coordination staff to work together, is when you have high needs. So those are those types of patients who have need for coordination are, often experiencing health inequity for racial reasons. Because there's a lot of sort of health inequity as it relates to Black and other minority communities where they don't have good access to healthcare. There's, a need for coordination of care if you have multiple comorbidities, if you've got chronic conditions, if you've got, if you're frail and elderly, if you've got serious mental illness, dementia, you don't have a lot of caregiver support. About a third of elderly folks are socially isolated, so they don't really have anybody to take care of them. And so they may go from one place to the other place, and then those doctors aren't necessarily working together. And a lot of us have personal experiences where, a loved one gets cancer and you get a first opinion somewhere else and you go to another place for a specialty procedure, and then, the medical records aren't moving and nobody's really talking to one another. So, so that's the group that we make an impact on. I'll give you a couple examples, and it applies to children, it applies to elderly. There was a patient who was in and out of the emergency room, and they were going to the emergency room, on a relatively frequent basis. And it turned out this patient, this child was a foster child. They were adopted, and were actually in a really abusive foster family. And so a care coordinator, as part of social services, was able to see that the patient was in the emergency room, found out the reason that they were there, and were able to set up the patient in an alternative home because it was unsafe for them in the home that they were in. So there's really impactful stories that we get to see on a daily basis from providers being able to work with the patients when they're having a clinical encounter in the emergency room or the hospital to make sure that they're getting the best follow-up care and they're getting into the right hands for the recovery.
That's amazing. Yeah, I think it's very interesting on how you are able to literally understand more about the patient holistically and not just on a disease level. I think that's very motivating. So let's maybe switch a bit more on when you started the company. So the idea, I think, that you had was, of course, great, But the idea is nothing without a good execution. And probably when you started talking about the providers, I'm pretty sure every provider said this makes sense. But you didn't have a product. Can you walk us through, okay, how did you really break through this chicken and egg problem where probably you wanted to sell the product, you sold a vision. I'm pretty sure a lot of people wanted this, but probably nobody believed you. Can you just walk us through the first few years of the company and how did you basically sell the vision ahead of the product?
Yeah, no, I appreciate using the word chicken and egg because I talk about chicken and eggs in startups because you're constantly facing chicken and eggs. You know, you're trying to get your first customer, and your first customer wants an ROI. Well, how are you supposed to get an ROI until you have your first customer? You know, you're trying to raise money, and you know the investor wants you to see traction. Well, how are you supposed to get traction until you have money to go do the thing? So it's just a constant series of chicken and eggs. You know, and in our business, where, just to use that example, given I know Cedar's based in New York City, you know, of let's say it's New York Presbyterian wanting to track when its patients land at the Montefiore emergency room. We have a chicken and egg there inherently because if Montefiore and New York Presbyterian are not on our network, it doesn't work. So we have to sell to New York Presbyterian that we'll get Montefiore on the network, and then we have to tell Montefiore, well, you know, will you join if we get New York Presbyterian on the network? So there's a lot of trust that needs to get built where we don't oversell, we don't overstep and say, oh yeah, we've already got them on because, you know, everybody talks to each other. So, you know, I think the best way that we think about, you know, how do you get something into market before it's in market and nobody, you know, nobody's willing to sort of take a leap of faith on you, is to break it into the most sort of immediate small bites that you can. So what we did is just to use an example. We had a health system in Boston called Steward Healthcare. They're a large healthcare system here in the Massachusetts area. And they said, we want to know when our patients go to the Mass General Hospital and the Brigham. Those are the two biggest academic medical centers here. And they wanted to know when they went to nursing homes. Because when patients go to nursing homes, oftentimes they're there longer than they need to be. And they'd rather be at home. And so Steward had a program to be able to support the patient's transition to nursing homes. So we said, okay, so there's two big hospitals, and then there's, you know, 55 nursing homes that you want to know when they go up to all these facilities. Let's really narrow that in. Where are the highest value notifications that we can start generating of all of those groups? We know that the hospitals are going to take a long time, but even within the 55 nursing homes, is there 3 that really matter to you? And so then we narrowed in on those 3, and we really locked in on those 3. And you know, we were able to see that if we got those 3, we would prove that there's value, that there's real, you know, that it can be done, you know, from a technology perspective. And then we were able to get going. So, you know, we really just narrowed it into kind of the most molecular sort of bites, execute on those, and then you kind of scale it up a little more, you scale it up a little more, and then, you know, then you end up where we are, you know, 7 years later, so.
It's awesome, yeah. When was the moment when you had the feeling, okay, I think we have a company, I think we have a business? In the beginning, it was probably just you have a good idea. People thought you were crazy. And then when you just deployed this very narrow, that doesn't mean really you have product market fit. When was the moment that you said, okay, PatientPing, I think will succeed and will thrive and will create a lot of impact?
Yeah, I'm sure you experienced this, Florian. I think that there was a moment where, you know, it clicked that there was an important problem to be solved. And that was actually well before I started the company. You know, there was a moment where a lot of entrepreneurs have this moment where they're like, okay, like this needs to exist in the world and you cannot get it out of your head. The bug bites you and you cannot get it out of your head. And I had that moment actually, you know, 8 months before I even started the company. And that was when I was site visiting a number of those ACOs. But I think, you know, once the company was started, of course, I was like, you know, there's probably, you know, 99 reasons why this should fail and 1 reason why it should succeed. So, you know, how am I going to know that? And, you know, as the company keeps progressing, there's still a lot of reasons why there's, you know, friction and difficulty and all those things. But I would say that once, you know, when the first notification went through to our first customer and they were like, oh my God, I'm getting a real-time visibility in this patient being at a nursing home. And before I used to get that through a fax or through a text occasionally, not all the time. And they saw it, it almost felt like, you know, when it felt like I draw a relationship, not often, but sometimes I draw a relationship between the internet and, like, you know, two computers talking to each other. Now they're networked, you know, and they can actually communicate with each other. It's almost like two doctors, two providers are able to now, you know about each other, and they were networked. And so when that happened, it was such a wow experience for our customer that I was like, this is definitely going to be a thing. I wasn't sure how big of a thing it was going to be, because, you know, maybe there isn't a big market for it. And as we kind of got into it, we realized there was more and more pockets of opportunity to do the same thing that we were doing originally, which was notifying that ACO when the patient went to a nursing home. And there's so many other use cases now that we've realized of the same product over, you know, over the years. But I would say that there was the moment that the product went live and somebody was like, oh my God, you just changed my life. I realized that this was going to be a business. Sorry, this is going to be an important product. Now, your other question is, when is this going to be a business? That was when it started realizing that there was real ROI from it. Like, the customer was going to be able to make real money by delivering on the outcomes that the notifications were facilitating. So we triggered them around opportunities to go generate cost savings. And then, you know, as we started seeing that they were actually able to deliver the returns, and we were a must-have component of that, and there's no way they could do that without us, that's when I realized, okay, there's a real business opportunity here.
Interesting. Yeah. I think it's always fascinating to hear on what is the difference between just solving a problem, but also having a sustainable business and sustainable company. Also, of course, investors approved your company and definitely said that there's a business and there's a huge problem to solve. So recently you did this Series C funding announcement that actually was already, I think, raised last year. Why did you wait so long to announce that? And what was the benefit versus the trade-offs when you did this?
Yeah, well, so we raised the money last year. And, you know, when we raised the money, we were doing it largely to deliver on this new kind of regulation, this new government regulation that was being put into place. And as you can imagine, with our business, the biggest bottleneck to growing our business is convincing the hospitals to share the data that we need to generate the notifications. So if you're, you know, near Presbyterian, you want to know your patient goes to Montefiore, we have to convince Montefiore to share their data so that it's called ADT information, admission, discharge, transfer information, to be able to facilitate the notification near Presbyterian. And, you know, there was this regulation that got passed that is going to require Montefiore to share this information. It just is a requirement. If New York Presbyterian wants it, Montefiore needs to be able to share it. And when that regulation got provisionally passed, I was like, oh, this is going to be a big opportunity for us to grow our network and grow into many more markets and grow faster. So we raised the money. The announcement, the finalization of that rule got delayed. It kept getting delayed and delayed and delayed and delayed because we were going to announce it and time it with the rule. It got delayed maybe 12 months. And so I kept being, you know, our marketing team was like, when are we going to do the announcement? And, you know, I was like, well, we should time it with this rule. And it's going to be imminent, and it just kept getting delayed. And then COVID happened, and then I was like, well, we can't announce it. Nobody was announcing fundraising when, you know, COVID first got announced. So anyways, it ended up being delayed. And then finally, when we announced it, the rule did get finalized. We were able to package it with the rule, but it was well after. The way I describe it is like, you know, sometimes people get pregnant and then they wait to tell their friends, you know, because they want to tie it to, you know, when they want to be safe, they want to make sure everything's okay. And then they tell their friends. So we raised the money, and then, you know, the announcement was later. It doesn't mean that the money wasn't raised. We never told anybody. We just announced it later.
Absolutely, and congratulations, of course, to that. So we got one question here from the audience, and instead of just waiting, because I think it's a timely topic on this, the question is, can you talk on how this product differs or works along with other provider communication tools?
Yeah, so I think providers use a lot of products to communicate with each other. There's a lot of like WhatsApp for doctors type products. So, you know, Tiger Text is one of them, and Vocera, and, you know, a lot of the EHRs have their own kind of text messaging and communication tools. And a lot of times the communication between doctors is triggered when a patient ends up in the emergency room or lands in the hospital. So, oh, hey, I got this patient here. let me get all the doctors on the line and communicate sometimes through text. So we feed into those programs, we feed into those products. We have APIs, or we have outbound integrations that we can use to help other applications access our information and then trigger downstream workflows. So we partner with a number of groups on both ends of our product.
Thank you. That's super helpful. Let's talk maybe a bit about growing a company and you as a leader. So being a CEO, of course, you have this great vision. You have probably a good hypothesis in the beginning, but then scaling the company also, I think, requires a lot of different skills. Most important, of course, is to have an amazing team, and very clearly PatientPing has an amazing team. Otherwise, you wouldn't have that much success. Can you just maybe share a bit you as a CEO and a founder? Where did you get, let's say, buddying support and advice from mentors, from other people that helped you on building the company that is not within the company?
Well, I'd say that sort of topic specific, I've always had people who I could turn to. So if it's industry related, or if it's, org and culture related, or, me as a CEO kind of managing my own sort of, psychoses, I suppose, like at various points along the way, and, the complexity and challenges that come with it. It's a really interesting set of sort of advisors and board members or investors or whatnot that I've been able to leverage. And I'd say that the number one skill that I've seen in leaders is sort of a deep desire to get better, to learn. And so I've been sort of a pretty voracious sort of consumer of information along the way. I will say though that with leadership, I used to read, every sort of business book that was out there, or leadership book, or founder book, or startup book. And, I click on all the clickbait of 5 better ways to be a more effective, CEO, and the HBR stuff. And at a certain point, I was like, you know what? I think what leadership really is about is authenticity, and just really being yourself, so that people can predict you and that they can trust you, that you really are yourself. So I'd say if I have a brand of leadership, it would be vulnerable leadership, authenticity, humility, really just putting it out there when I don't have the answers to things, and really, entrusting our teams to come together to be able to, to figure out the answers. So I got that advice from, I'd say, the leaders that I've always been drawn to in my career. Have always sort of had a much more sort of open and transparent and approach, and their character has generally been like that. And I think that's sort of worked for our company. I'm curious. Same question for you, Florian. Who have you leveraged as advisors to to scale your company?
Yeah, I think it's so I totally agree with you that I think there are a lot of, the tactical management books. They literally don't help you not to make the mistake, but I think they help you maybe to detect the mistake a little bit earlier. I think so. So that's literally what I saw. So they're definitely not the solution to anything. I love to read biographies of other business leaders. Doesn't have to be in healthcare, doesn't have to be in tech entrepreneurship, but one of my favorite books is, for example, Sam Walton's book. I just love that book. Because it just shows a lot of things that you can do right or wrong as a leader. I think that's the first thing. The second is a lot of peers. So I'm talking very often to either other founders or executives at other companies, but not necessarily, they don't necessarily need to be super senior. Sometimes it's also entry-level people, just to ask them, okay, what do you really like in your company? What do you not like? Yeah. And I'm asking a lot of people that, and even when I interview candidates, I literally always ask them, hey, what are the things that you love at your current job? What do you love on your leadership? What do you not like on your leadership? And then, of course, I had jobs on myself before, and I did very thorough analysis on how I felt with that management in place and me not being the CEO, and learned very well on, what are the things that just motivate me as a team member? And what I just love, which is, for example, for us, is transparency. I totally agree with you on the vulnerability. That's extremely important. I think just to share nobody is perfect, and definitely not the founder CEO. We are as I think as equipped with strengths and weaknesses as anybody else, and just being aware and sharing that with the team, because that makes you better.
Yeah.
If you share with the team where you're working on, the team will open up to you.
Yeah,
and I think those are the very, very important pieces, and I'm extremely grateful to my team on how they are helping me also to become a better leader.
Yeah, I remember we had on the point on peers. I remember we had I miss being able to have kind of all of the conferences and the peer networking. I remember we met for the first time at that it was like a dinner in Boston. Do you remember that?
Yeah,
you were just getting started with Cedar, and we were still very early stage, so that was a lot of fun.
Yeah, and it's very different skills that you basically need throughout the time. So I think it's exchanging information is extremely important. Absolutely. Can we talk a bit about maybe shifting the topic now to more towards product management? What do you think makes product management and development in healthcare so special, difficult, or easy? How is it different from anything else?
Yeah, so in healthcare, so product, I think product is solving for, product is working to solve problems. And in healthcare, geez, sorry, there's a motorcycle outside. In product, I think in healthcare in particular, you're solving for customer outcomes and user outcomes, which is typically what most enterprise software businesses are solving for, as well as patient outcomes, which is a unique part of healthcare. And on the customer side, it's often that the customer that you're solving the problem for may not be ultimately the one to whom the value is accruing. So you may be solving a problem for a hospital or a physician organization, but the value is actually accruing to the health plan, to the payer. So sometimes you have multiple customers that you're trying to support, which it's sort of it forces you to ask the question, who am I really supporting? Who am I really doing this work for? And so, as a product manager, I think you have to think about so many different layers that when you're building the products that you're building, you're trying to solve for the customer pain points and deliver value, economic value to make, to help the customer generate a return on the product that they're going to buy. At the user level, you want to solve their problems, meaning you want to save them time. Typically in an enterprise setting, when you buy software, it's to save you time, it's to make you more efficient, it's to get your job done faster or better. And so you got to be thinking about the user as well and the day-to-day existence and how they approach their lives, and then you want to make those lives better. And if it's a clinical user, those clinical workflows are really tightly wound for a good reason. You're dealing with life and death a lot of times. And so, if you're going to insert a product into a very tightly wound workflow, it's got to be good, and it's got to be real value adding. And then at the patient level, sometimes the work that the provider is doing is one step, you see the downstream impact of the patient outcomes, but it's hard to really measure that because you don't have the data necessarily. You're not able to sort of track that. So, I think it gets really complicated if you're, and it's hard to really compare to other products because I haven't, been a product manager in those other products. But when you've got one user, let's say you're YouTube and you're trying to just get people to look at look at more videos, they're probably also solving for looking at videos to the point where they can get, more ad revenue through those eyeballs. So there's a little bit of the payer, user dynamic. But I do think when you're solving for so many different types of end sort of end stakeholders, it adds some complexity to the product management process.
That's super helpful, and I might also switch here right now to some of the Q&A from the audience because they're pretty related to your product. And one of the question is, how do you go about measuring ROI for PatientPing customers, especially when many are longer term health outcomes based?
Yeah, so we think about our customers in a few different groups. So one is risk-bearing entities. So for them, their job, how they generate revenue as a business is to manage a patient population and reduce the cost of care for that population through higher quality care. They're not utilization management. They're not reducing the price that they're paying per procedure. They're really trying to do a lot of work to coordinate care so that the patients stay away from the hospital, stay out of the ER. So we look at, to the extent we are helping them save money, in terms of reduced utilization. So that's a very clear ROI. It's the same for a payer. It's the same for an at-risk provider. And there's a number of providers within the market who are lower cost than the hospital, that are an alternate site of care than the hospital, the emergency room. And so for those providers, what we want to do is drive volume to them. So if you could be in a nursing home as opposed to the hospital, or you could be in a home health agency as opposed to a nursing home, or you could be out of the nursing home in 10 days as opposed to being there for 25 days, that's the sort of thing that we want to facilitate, because then the overall costs in the system come down. But for that particular low cost, high quality provider, they get volume. So it's just driving volume to that provider. So we look at to the extent we're driving volume to that provider. So where does that leave the hospital? The hospital is usually the one that loses in this whole situation, but it's actually not that true, because what it means is that if a patient who is in the hospital, who was there for, just to be hyperbolic, let's just say they were there because they got a bump or a bruise. Well, that patient probably could be better served in an outpatient clinic, so that the hospital can use that bed for somebody who's a burn patient, or experiencing trauma because they had something happen to them. And those tend to be higher revenue patients for the hospital. So what we're doing is moving care to the right destination, so that the overall costs in the region come down, therefore the payers and the at-risk providers gain. We drive volume to the low-cost providers, and then we help the hospitals adjust their case mix towards the highest revenue patients.
That's awesome. Yeah, I think over the long run, the ROI is probably very, very clear in terms of financial metrics, and also on the patient satisfaction side. I'm pretty sure that this has a huge impact, and especially when you say, okay, the status quo was something like sending a fax to know sometimes where the patient goes.
Yeah.
There clearly is an opportunity to make that better. There's another question here from the audience, which is also a bit related to that, is what types of insights are you able to provide with the EHR data you can access that improve quality of care?
Yeah. So just to map clearly what we do. So we pull information from various points of care. So meaning physical boxes where patients receive care. So that could be an emergency room, that could be a hospital, that could be a skilled nursing facility, could be a home health agency. What we pull from those facilities is called an ADT feed, an admission discharge transfer feed. That comes out of their EHR. So we're already pulling data out of the EHR, and then we're comparing that against a list of patients that a physician organization or a health plan may have, and then we'll match the two, and then we send a notification. Sometimes they get the notification, they say, oh, we see that Florian's in the ER. Well, what else happened? Why are they there? And we'll say the reason for visit. That often comes from the ADT information. But they may say, did they run any tests? And what were the results of those tests? What were the lab results? And, or were there any imaging scans done? And, so there may be additional ancillary information that the provider wants. And in some markets, we do pull that additional information. And that's also contained within the EHR. And we'll append the notification. We call it a ping. With some ancillary information that could enrich the information that the notification receiver is getting.
That's interesting. Yeah. I think that's why I really admire your product. You completely started a new product that never existed even close to before. It's something completely brand new. So when you compare it, for example, with Cedar, billing and patient engagement is not right now the most innovative thing. It was done pretty poorly. So we basically took an existing process and make it just infinitely better. And you literally started from scratch and nothing existed, and established a process and a really successful product from that. So really congratulations to that. Let's maybe shift a bit more on back to the company. We talked about you as a leader and the team that you built up. Can you talk a bit about culture, and how did you, what are you doing to really establish a positive and inclusive culture, and what are you the most proud of on your team? I think both of our companies have pretty much the same size, 130 people or so. Can you talk a bit about that?
Yeah, so I think the end of the day, culture is obviously not the ping pong table or the cold brew machine, which nobody's getting any benefit of that right now. Culture is the people. It's the people that you attract. It's the people that you keep. It's the people that you reward. It's who you work hard to retain, because they represent the values that you want to promote within the organization. And then it's also what you let slide. So if somebody exhibits behaviors within your organization that aren't necessarily to the level or standards, of what you want your organization to run at, and you let that happen within your organization, now all of a sudden you've dropped the bar. It automatically is happening. So it can be exhausting to keep holding the line as high as you want to hold it, because who wants to be giving feedback? Who wants to be kind of pushing people to strive to be at a certain level, because it's hard work. But to me, culture is really about the standards that you hold your team to, and what you reward, and then what you don't reward. And for us, we have 5 values: grit, rigor, ownership, humility, and authenticity. And those are very important values for us. They're part of our performance review process. They're really critical components to how we sort of think about promotions and rewards within the organization. I can go through each of those values, but really that's at the center of our culture, I would say, and ensuring that a lot of our team represents those values. And the thing that I'm most proud of is that often, so whenever a new hire joins PatientPing, I do we have like a few weeks after they've joined, we have a meeting with the new hire cohort, and I always ask them 2 questions. One's a 2-part question, and the other is a 1-part question. And the first question I ask them is, tell me a moment where you thought, oh, this is great, I'm so excited to be here. And tell me a moment where you said, oh shit, what did I just sign up for? Get me out of here. So that's like the first thing. So part of it is like expectations to reality, what you thought you were signing up for. But then, then the second question I ask is, when you shift cultures, when you go from one place to a new place, you're very observant, you're hyper observant, you're noticing everything. You see how you pick up on people's behaviors, and then at some point that fades because you're becoming part of the culture, and everybody's looking at you now to sort of figure out how they should behave and what cues to sort of act on. And pretty consistently, what I hear from people for the second question, which is what have you observed? And sorry, the second question is, given you're in this sort of new mindset, where you're seeing everything, you're hyper observant, what are some of your big observations about our culture? And typically what we hear is, it's amazingly transparent. Wow, I can't believe how collaborative people are. I can't believe how helpful people are. I feel like I can go ask people any question, and then they'll just sort of reach out to me and they'll go out of their way to help me. And I think that's what I feel very proud of, is that people really are excited to help one another. It's very mission driven, our organization. People are excited to support one another. And the collaboration is something that you want to feel. You want to be in a company and you want to feel like you can collaborate with your peers and you enjoy that process. And I think we have that. It's obviously not perfect, and it's never perfect, and we can always be better. But I do think that I do feel pretty proud about the level of collaboration that we have in the organization.
That's awesome. Yeah, I think it's super important to always focus on the culture. Otherwise, of course, the culture will at some point struggle. Can you just maybe share a bit more on how the culture changed over the time?
I mean, say that it's some of the things have maintained to be true, like the way that we approach decision making with rigor, the fact that we have this saying in a company called polite persistence, where with a customer who's we're trying to get across the finish line and they're no, or they're not ready, and polite is grit. It's just sort of keep going, resiliency, because there will be a path, and if not, let's figure out what's missing and let's figure out how we can adapt and modify our solution to get there. We've always had a very strong ownership culture, meaning a lot of our employees sort of feel ownership. I use this analog. I'll tell the story. I use this. There's a fable for the chicken and the pig, and so very short. Chicken goes to a pig and says, "Hey, do you want to start a restaurant?" And the pig says, "Sure. What do you want to call it?" And the chicken says, "What about ham and eggs?" And the pig says, no, because if we do that, I'm going to be on the line and you're just going to be committed. And the idea is that, so a chicken can just lay eggs, but a pig, they're in this situation, their ass is on the line. So, an owner is really somebody who wants to put themselves in a position where they're accountable, where they feel accountable for their outcomes, where they feel like what they're going to do is going to result in a reward. And if they fail, then it's not going to result. And then, then they're going to see the impact of that. And so we really encourage people to take, to be the pig, to act like an owner. And I think that's been consistent throughout. Some of the things that have changed is, it's hard to scale some of the, some of the processes. What's the best way to describe it? I would say that before, we had a lot of general athletes, a lot of people who just sort of were there to, do the work, and, they didn't necessarily have any specific skills, but they veered in one way or another. They were more technical oriented, they were more customer oriented and service oriented, they were more sales oriented. But everybody can kind of do everybody else's jobs. I think as we've scaled, we've gotten a lot more specialization, and within the specialization, certain skills and certain behaviors and qualities are more important. So I think we're more of a team. We're a team of teams, and we all kind of work together. And I think that's probably been an observation that I've learned. It's not everybody doesn't necessarily have to have all the same. Certainly doesn't have all the same skill sets. That would be a mistake, I think. But there is a common thread across everybody in terms of the values. Same question for you, Florian. I'm curious, like what are some of the cultural attributes that you're most proud of, or and how have you seen it change over the years?
Yeah, so I mean, maybe the second question first. It definitely changes over time, and I actually think I mean, there's some people say culture should never change. I completely disagree with that. I think culture should change over time because the company also changes over time. In the beginning, in the end, the culture is kind of course, aligned with the values, and the values in the end are an extension of the personal values of the founders. It's just what it is, right? Because you're in the beginning, it's a company of one, and for us, we only have four values to literally say, okay, because there are a lot of values that are kind of, yeah, that are more permission to play values, where you say, okay, that's of course, be honest, right? Yeah, of course, do we need to be honest, right? Work hard, yeah, of course, do we need to work hard, and so on, right? So we basically say it's four things that really matter. Is the first is focus on our vision, because there's so many things you really want to work on that might become interesting. Always focusing on our vision is extremely important, and to literally dive deep into this and try to solve the problem. The second is no mediocrity. We strongly believe everybody else in the space where we act, they're mediocre. They're not terrible, then they'll be out of business. They're not great, then we wouldn't have a problem in healthcare billing. So they're mediocre. We cannot win if we are mediocre. We strongly do that. And then the next is use your good judgment. We think a company is actually more scalable if you have fewer rules, but you can only have fewer rules if the people have good judgment. And you're always getting in a startup, and you know this probably better than anybody else, you always have problems that you encounter that never existed before. So having rules completely, I think, it takes the mandate away of people to think, and that is not the right thing to do. And then the last is be positive. And be positive for us means a few things. There will be a lot of setbacks. You will have losses. We will lose deals that we can sell. We will make mistakes. We will lose candidates. We have problems from the government. There will be a lot of setbacks. We strongly want that we learn from this. And we get these setbacks. That's fine if we make the mistakes once, but then we want to learn. And we rather want to say afterwards, oh, this was actually great that this happened to us, didn't kill us, and we got better through it. Yeah. And that's the same with getting feedback. When you give me feedback right now, I rather want to say, hey, thank you so much for making me better. I really appreciate that. Instead of, hey, Jay, you pointed out my mistakes. So those are our values. And we, of course, adhere very relentlessly to them. Having transparency, that's definitely one of the things we are doing quite a bit. So we always share our board documents. Everybody in the company knows our financials. I'm sharing my 360 review with the company. Everybody knows what people think about me, how I, what are the topics I need to work on, what are the things I'm doing well. So we try to literally be very, very transparent. And I think that helps also. The other piece, which you mentioned, is the ownership. Right? Everybody is a shareholder of Cedar, and you cannot ask for people having the ownership of the company without them having access to every single information. It is just important for the motivation. So I strongly believe that. And how it changed over time, that was your second question. I totally agree with you. In the beginning, of course, you had very entrepreneurial people who were totally fine doing anything, jack of all trades. I mean, you did everything in the beginning. You assembled your furniture probably, so did I. And people being very happy and thriving in this uncertainty. And I think over time, you of course hire more specialists, more people join the company that are that are thriving and having a distinct area where they really can go deep and are subject matter expertise. I think those are the very important kind of definitions, and also, of course, thriving on certainty. People that join a company at a later stage, they usually thrive in a bit more certain environment. So it's not like a typical example is right now with COVID. I think in the past, when you're a very small company, you just say, okay, we work from home, and whenever the system gets better, I'll call you up and then we come back. I think right now this changes over time, and we rather want to give people a bit more planability so that they know where will they be in 6 months, in 12 months. And that's of course also trickles down then to for example, planning the career, on how they can make advancements, titles, and so on.
Yeah.
Maybe one last question, and then I want to address some of the Q&A. And just as a disclaimer, we will not be able to get through all of the Q&A. There are a bunch of questions, and thanks for sending all of them. Maybe my last question is, and of course, and you might be already bored of that, Jay, COVID-19 is of course a great topic we want to discuss, right? So how has that impacted PatientPing, and what are the changes on your operational model that you have had to serve your patients during this time?
Yeah, so we have our growth, forecast every year, and we sell into three primary segments. So one is health systems. The other, we call it provider growth. So that's everything that isn't a health system, but it's a provider, mostly post-acute providers and outpatient providers. And the third is payers. I'd say that the payers have been unaffected. In fact, they're swimming in money right now. There's no claims. There's much fewer claims. I mean, they're coming back, but much fewer claims. On the provider growth side, a lot of outpatient providers right now are trying to refill their clinics and get volume back. And they're seeing that being able to initiate an outreach with a patient after they've been hospitalized or show up in the emergency room is a great time to invite them back into their clinic. So we're seeing some increases there. Skilled nursing facilities are in big trouble right now. I mean, that's where in New Jersey, as an example, that's where 40% of the deaths were. It's really, really bad for nursing homes right now. Nursing homes are entirely designed to be socially close, which is the opposite of socially distant, and to create community in a common space for elderly people. And so they've been really underwater, and so we've seen slowdown there. And then on the health system side, hospitals for a while were really rocked, and they weren't really talking to any vendors that weren't selling ventilators or PPE, and so there was a period of time, but the hospitals are coming back again. So we're seeing some pickup on the health system side. So overall, we had projected a certain amount. We cut that forecast down by a little bit. We're going to beat that forecast that we brought it down to. We thought our churn was going to go up, and in times like this, I think it's really helpful to see what's going to happen, how important your product is by tracking churn. Are you nice to have? Are you a need to have? And because when people are really examining their budgets, they're going to cut the things that they definitely don't need. But we've seen much more favorable churn than we were expecting. So customers have kept the products, they kept their contracts, they're renewing. So we've been very pleased about that. So overall, it's been a little bit of an impact, but not too bad.
That's great to hear. Great, we have another 8 minutes left, so I'd like to go to the Q&A if that's fine for you. The first question is, what was more challenging to raise, the Series C or seed round? what were the benchmarks you had to meet for each of these rounds? Thank you.
I'd say they were both equally. Our fundraising process has been a little weird. Our seed round was just unusually easy, and I don't mean that with an ego. Like, I really don't mean that. It happened to be that I was meeting a venture capitalist. I wasn't actually raising money. He got super interested just from me telling him what he wanted to do. He sort of insisted on trying to invest. That made it really easy. Gave us a term sheet before before I was even doing a raise, and then it made it very easy to talk to other VCs, and get a round done after we decided we were going to do a raise. So it was easy, but really, I mean, the ease or the difficulty of the round is really a function of how you've been performing and what you're going to do and the clarity of what you're trying to accomplish next. And I think at the seed round, it was really easy for me to talk about what we've accomplished because it wasn't much, but it was enough to say that there's some validation in the market. But I was also extremely clear on what we were trying to accomplish, at least in an 18 to 24 month window, and then what the implications could be afterwards. It was hyper clear. So it wasn't a hard conversation to have with an investor. It was like, either you see it or you don't see it. And if you see it, then let's go do this. At the Series C, it becomes less about, it's very much about like, are you going to be the king of the category that's being created? How big is the category that's being created? Are you going to be the winner that kind of takes most of the market? And then what is really going to be built on top of this platform that you're establishing? And one of the things that I've seen, at least for me, has been really difficult. And I talked to other founders, I've talked to venture capitalists, like, going from a single product to a portfolio of products is really hard. It's really, really hard. And I think for a long time, if your first product is really scaling super well, you don't have to worry about the second product. And we've had that luxury for a long time. But as you get into now the next product and the portfolio that you're building, you have to build infrastructure to innovate and keep doing that. And I'd say that is something that we've done well at various points along the way. We've done poorly at various points along the way. And the Series C, the burden on proving that you're not just a one product, organization is the burdens on the company. And we haven't necessarily demonstrated that with the scale and intensity that I think we're going to need to. But I think investors believe that we have the organizational DNA to be able to pull it off. But the burden is, the burden is higher. So I would say the C was probably a little bit harder than the seed, but different. So.
Yeah, that's very helpful. And then maybe the last question is actually to both of us. A question for both presenters. Any suggestions on how to network in current times, especially if you don't have an established network in a given market? Thank you.
That's a great question. You can go first, Florian, if you have.
All right, then let me get started. So I very frankly, I cut back on the networking quite a bit. So let's be transparent about that. I was probably never since starting Cedar an amazing networker, or I didn't go to many conferences that were not geared towards meeting providers and talking about Cedar. I did not go to any of the technology conferences or TechCrunch or whatsoever. So on the networking side, I think that's very specific. I still, of course, meet interesting people, and I think it's much more targeted. So what I right now do, and I think that can be maybe one of the advice the person was asking for. And how do you establish this networking? I think the best is go through your existing network and ask for introductions. That's the most important thing, but be specific on it. I think it's very tough just asking, I don't know, I want to get in touch with one of Jay's connections, and you see that on LinkedIn, or I know that he's a connection. I just ask, hey, can you introduce me to XYZ? Jay probably will say, okay, I'm happy to do this, but what is in there for the other person? So I think being specific is extremely important. Yeah. It could make sense that I go to Jay and I say, Jay, I know you're connected to this person. I'm really concerned about how do I scale my team remotely. And I know XYZ is a founder of another company that excelled in that. I would love to talk to that person. And of course, would try to be a sounding board for that person as well. So I think being way more specific, way more targeted can be also more efficient actually. So you probably will do less networking, but it can be more meaningful.
Yeah, I totally, that's such a good piece of advice, Florian. I think having an agenda, right, I'm just reflecting on all the networking that I've done over my career. And I tend to be, I'm a pretty extroverted guy. I like being around, other people, and like, it's fun for me to just ask them about what they're working on and, what they're passionate about. And, so if it's at a conference or wherever, I enjoy that process. But I think I've always had something in my head that I wanted to figure out the answer to, whether it was a particular business sort of scaling question or a particular topic in our industry or something thorny about why something works a certain way. I had an agenda, and then, leverage the existing, it's spot on. I think that's really great advice. And I think, beyond that, there are the ease of doing virtual events like this, important people, who are typically busy on planes and traveling and, doing a lot, are a lot more accessible right now. Being able to ask them and say, hey, can I get 30 minutes? Because they're at home, mostly. Most people who tend to be like traveling or, in the middle of a million things, just have more schedule availability than I've seen in the past. So I think, being unafraid to just ask. I think today is a little more, people are more willing to get on the phone or get on a webinar than they have been in the past.
Yeah, totally agreed. Jay, thank you so much for taking the time. It was extremely inspiring, and I really, really enjoyed the conversation. And I certainly learned a lot. And I think especially your two-tiered question for new employees, I might copy you on that. I'll definitely let you know on what I can learn from that. But thanks a lot for taking the time, and thanks everyone, of course, for joining 2 p.m. Eastern time. And our next event will be on November 11th, where Mark Andreessen and Scott Cooper from Andreessen Horowitz will be having a panel together with me. Thanks everybody for tuning in, and have a great day, Jay.
Thank you. Take care, Florian.
Take care.